Hello, everyone, and thanks for spending time with HWA yet again. We have Father's Day, Juneteenth, the anniversary of the George Floyd slaying, and National Men's Health Month, all in the month of June. And perfect timing to chat about Black men and our health. So last month, if you remember, that was May, I was interviewed by Dr. BCW in honor of Women's Health Month. So this month, she will be returning the favor. And guys, listen, this is important stuff. As a group, Black men have the lowest life expectancy and the highest death rate compared to both men and women of other racial and ethnic groups.
Yes, it's so important to highlight how Black men live 7 years less than men of other racial groups. And Black men are more likely to die from chronic health conditions like heart disease, diabetes, and cancer. So, let's go ahead and just hop right in. And, when I think of the statistics that I just mentioned, I pause because you need to pause when you think about what I just mentioned, how one racial group is disproportionately affected, as well as a gender group. So let's dig in and talk about some of the topics that surround this and really allow a collective voice to this issue. So first, Eugene, I would love to know, what are some of the unique challenges that are faced by the Black community as it pertains to Black men and health management?
Yeah, and I think that's a really great question to kind of kick off the conversation. I think when we think about it, there's some of the usual suspects. There's lack of access, there's discrimination, there's unfairly high incarceration rates. All those things play a factor into Black men and our health. I think there's two things as it pertains to Black men specifically. The first one is a bit of a generational thing. There's a lack of Black fathers in the household. And you and I can both speak to the fact that, growing up with a Black father in your house, or a father in general in your house, is a very, very impactful and powerful experience. So that would mean that, as a young boy, you have less of a healthcare role model. You don't have a guy that you can look at that is exhibiting the positive behaviors around healthcare, especially when it comes to Black men. So we just kind of play out a silly scenario. Dad comes home from work, dad asks son, "Hey son, how was school today?" Son says, "Well, school was good, Dad." "Well, what did you do?" "Went to school, went to practice, did homework, and now we're having dinner." "How was your day, Dad?" "Well, actually, son, it was pretty good. Normal work day. I did go to the doctor during lunch, super quickly." So, as a parent or anybody around young children, that children are like sponges. And that conversation lasted 10 seconds. But the amount of information that was actually absorbed and will be retained and processed is incredibly impactful. Number one, you asked about my day, so Black man to Black man. There's value in that, right? You care about it. It would happen to me since the last time you saw me, which was probably 7 o'clock this morning. But then the other part of it is, Dad just mentioned that pretty casually and comfortably that I went to the doctor. And as a Black boy, it suggests that every time you go to the doctor, it's not the end of the world. Dad seemed very comfortable. It was almost like a footnote in our conversation, but it means a lot because now I do want to learn a bit more about it. But if nothing else, I know that it feels a little less scary because the hero in our household went to the doctor. He's home and he seems like he felt pretty good about it. So I think that's probably the number one thing. I think the second unique factor as it pertains to Black men and health management is, we've kind of become a bit desensitized around Black men and death. And there's two parts to that even. Growing up in a Black community, it's not unusual for a Black man to drop dead before the age of 60. It would not be jarring to anybody. It's always unfortunate, but that my mom is going to live longer than Papa. That's just how that plays out. And the reasons behind, what I'm referring to, natural causes, underlying conditions, things that had nothing to do with anything but Pop just did wake up that morning and he really wasn't that old. So I think that part of it, as far as the Black community goes, that's not jarring enough to us anymore. It's kind of normal. I think the other part of that, as it pertains to Black men and Black men dying way too young, is the violence, the homicide rate. And we'll talk a bit more about that as well, because that is really, really very important. But, when you turn on the local news, 22 minutes of the 30 minutes will be about Black men killing Black men. And it's almost become reality TV. It normalizes it. It makes it a little bit less scary. No one feels good about it, but you move on and in the next episode, you watch as Family Feud. I think those two aspects of being a Black male and how healthcare is introduced to us, how we manage it, the value that's put on our lives, not only by others, but also by ourselves, is really important, really unique to the Black male experience.
And I love how you said, the value that is put on our life. And there are so many different pieces that allow that value to even resonate or be known, which it should just be expected. And I think that's a huge piece that you mentioned. And when we talk about Black men dying from underlying health conditions, like you mentioned, not even environmental, it adds to the fact when we add the social justice, all of the other things that are happening right now, you put that on top. And then there's no wonder why there is a disproportional loss of years of expectancy for Black men. And that kind of delves into, we know since 2014, Black men have lost 6 years of life expectancy. So I would love to know your thoughts on some of the environmental factors.
Great question. And yes, since 2014, life expectancy for Black men dropped 5.8, close to 6 years, from 72 and a half years old to 66.7 years. That is horrible. That should be jarring to anybody that absorbed that data point just now. And it also means, we kind of put the math behind this, that means that essentially your health and your quality of life and just how you feel as a person, to die in mid-60s, you must have been declining in the 50s, early 60s. So you haven't had a long stretch of quality life since, as a Black man, since you were a kid. To put more context around that, Black women also lost some years, about 4 years, from 78 and a half to 74.8 years. Black women still live a year longer or so than white men. White men lost about 3 years. And then white women continue to reign supreme at 2.2 years lost. So everyone's on a bit of a decline, but based on the ratios, Black men are dying much younger, much more often, and it's a troubling thing to think about, especially as a Black man. I think that piece of it is part one. Part two, after giving us a bit more thought, I did a little research on the top causes for Black men in death, and heart disease is number one. So I'm thinking, okay, it's difficult to tackle all the problems all the time. How can we get better with heart disease? How can we attack the number one culprit? And although heart disease can be tracked back to family history, that's absolutely documented. No one's arguing against that at all. Stress and lifestyle play major contributors to our heart health in general, and in particular in Black men. So heart disease is number one as it pertains to the leading cause. Homicide is number three. Those two factors, those two means of death for Black men combined account for more than 30% of Black men dying. That is 1 out of every 3 Black men is going to die from heart disease or being murdered. That is troubling on so many levels. It's ridiculous. But if you start to connect those two, people generally have greater stress when they don't feel safe, where they live. And if you don't feel safe around your community, your neighborhood, your stress levels are going to go way up, and that stress becomes literally poison to your heart. Perfect example, I've talked about this several times. I live in the Northeast, Philly specifically, and we love Wawa. I love Wawa. We go to Wawa all the time. There's a Wawa about a mile away from my home. I don't go to that Wawa because that Wawa has a lot of people in it that look exactly like me. There's more of a chance, more of a likelihood that there could be some type of trouble, and I want no parts of that. Will it happen? Will it not happen? I have no idea. But the stress involved with walking into that Wawa, I don't really think that it's worth the risk. I will go a few miles further out to a different Wawa. On the flip side of that, no one in that Wawa looks like me, and I'm still not that crazy about going into that Wawa, not necessarily because of physical harm, but it's always pretty uncomfortable as well as stressful to be in a room full of people that don't want you there. That's kind of a simple microcosmic type of example, but think about all the other types of factors of stress that a Black man, especially living in a Black community in the inner city, may have to endure from day to day. So that stress builds up, it becomes literally poison. And we'll need to talk about ways to reduce the stress so that heart disease won't be so much affected by your stress level. The other part of it is that's really important is lifestyle. Again, heart disease can be tied right back to family history, but your lifestyle plays a huge factor in it as well. And it's just as simple as be better to your body. If you're going to make a change as far as exercise or diet or whatever, do it today. Stop waiting for like that sweet spot between your birthday and the holiday season, because there's so many things going on and you're going to be, involved in parties where there's going to be, foods and those types of things. Do it today, because the sooner that you're able to create positive health habits, the more likely it will be that you'll stick with those things. And also be able to demonstrate to people in your household, in your community, in your neighborhood that, yeah, there's a different way to live, and it may even extend in our lives. So I think to answer the question, how do we get 6 years back? Give yourself less to worry about. There's certain things everyone just can't pick up and move. So yeah, that's a difficult thing to do, but you can remove toxic people, toxic relationships. Maybe that job has just gotten to the point where it's not healthy for you anymore. There are some things that we can control to at least do what we can do to reduce those stress levels. And then the other thing is that it goes back to lifestyle, exercise, and that can be a casual walk around the neighborhood. Sleep more, eat less fried food. It can be, that sounds simple, but it can be literally that simple. And I mean, my sister, for example, lost 50 pounds in 3 months, and she ain't running no 10Ks. She just made some adjustments to her lifestyle, and she looks amazing, she feels amazing. So it can absolutely happen when it becomes something that's important to you.
So you mentioned how be better to your body. Well, when you're being better to your body and your mind, it does have, a true effect on your overall health. And so often people are surprised that when we talk about stress, and when we talk about physical exercise, all of those things are, as you mentioned, heart healthy. And often people are surprised that when you are stressed, your blood pressure goes up. And when your blood pressure goes up, that is stress on your heart. And so when you're thinking about being better, be better for your mind and your body together, because they all have different impact throughout your entire system. So I'm so glad that you mentioned that.
That is a really, really good point. The way the body is a really complicated ecosystem, but you can help itself a bit. So the stress will increase your blood pressure. If you have some things going on with cholesterol because your lifestyle might not be what it should be, arteries may be a bit clogged. Now we have a lot of problems going on. Now we're talking about heart disease, strokes, and all the other complications that come from that, just because, I don't want to say just because, but because of stress. Understanding that a bit better, hopefully people will feel motivated to remove what they can as it pertains to, just kind of being better to your body and controlling some of the exterior factors that your body finds harmful.
And I love that you mentioned that too, because you have to think about investing in yourself. And you had mentioned you intentionally choose places where you feel comfortable and know the places that you don't. And that is providing health, not only for your mind, but your body, and providing a level of longevity to hopefully reduce your risk of developing heart disease and other factors as well. All right. So, I would love to hear your thoughts on how we can work to educate and empower Black men to take control of their healthcare, as well as to ensure a more improved quality of life. What are your thoughts on that?
I think it comes back to a couple of things. I think that peer pressure is undefeated. People that feel like they may be in the forefront when it comes to their health care and their healthcare management. You need to talk to your friends, your family, expose your son to the fact that your grandson, nieces, whatever, nephews, that I go to the doctor and I feel good because I go to the doctor. It's a okay thing to do. I strongly advocate for Black doctors as well. Black doctors help Black patients live a little bit longer. So anytime Black men are losing 6 years, we can get a year and a half back because we have a Black doctor. That is huge. Now you're talking about moments in life that you have a chance not to miss. And we're in graduation season and prom season, and you don't want to not be around for those things because you didn't give yourself every opportunity. So I think peer pressure is really important because we can help to educate each other around the importance of proper healthcare and healthcare management. I think the other thing that's really important as a Black man is, although a lot of times what we see I'll just say on TV, I don't want to make a particular news channel, guilty here, but a lot of times the imagery that we see, it's not positive about us and not positive about, how and why we're dying. As a Black man, believe that someone cares about you. Believe that someone actually wants you to hang around. And if there's not a patriarch to the family, be that guy. Be the leader, be the voice, be the central point, the hub, the point guard, because you're more likely to take care of yourself if people are depending on you. And if that is the motivation that gets you from losing 6 years, only losing 4 years, and now you actually make it to your 70s, that is huge. And anyone that's around you that cares for you and that you care for will absolutely appreciate that. So I think when it comes to the education and the empowerment, I think that is something that we should and could do better as a Black community. I think that it's our responsibility to take better care of each other in general. The Black male and his life has been devalued. Let's get some value back into it and make sure that those guys understand how important they are to everything we do every day.
Yes. And, we're going to push peer pressure. We often hear it in a negative light, but just the way you described it, Eugene, we can use that to do good, to have positivity and to help each other. And that peer pressure leads to accountability, which leads to better outcome. And so that's something that we need to keep at the forefront.
Yeah. I completely agree. And Dr. BCW, this is amazing. Always on point with your questions, as always. Everyone watching this video right now, please leave comments. Please hit us up directly, direct messages. Tons of people have done this in the past, whether it's through the particular app or text messaging, phone call. And this is what we're here for. This is what we're trying to do. If we can, again, like we said several times, if we can pollinate just a little bit of our healthcare wisdom, and you guys can kind of push it along and make sure that others are absorbing this information as well, then we've done our job. So this is incredible. Hope everyone's gotten off to a great start to this summer. And as always, be healthy, be better, and live better together.
Yes. Thank you, Eugene. Thank you, everyone.